I have one of my favorite people here today with us, Dr. David Hasse. He's a good friend from the Institute of Functional Medicine. He has a clinic, the Maxwell Clinic in Nashville, Tennessee, where he's been practicing functional medicine for far longer than I have, helping people with all kinds of issues, including allergies, autoimmune diseases, and a lot of issues regarding the brain. So that's really what we're going to be talking about today. And the title of your talk is Overcoming the Fog, Fatigue, Fear, Funk of the Autoimmune Brain. How are you?
I'm great, Amy. Thank you very much for having me.
So what does all this brain health have to do with autoimmunity?
I have 4 basic symptoms that come up when an individual has an autoimmune condition. Whether that autoimmune condition happens to be hypothyroidism, Hashimoto's thyroiditis, or Sjogren's disease, lupus, rheumatoid arthritis. Fatigue is certainly one of the major symptoms that come up, correct?
Mm-hmm.
So what organ governs fatigue?
The brain.
The brain, right. But we don't think about that, do we? We
No.
think I'm just fatigued. We think it's my body is fatigued. When instead, if you give a neurochemical, you give a stimulant to somebody that stimulates their brain, ta-da, they now have energy.
Mm-hmm.
It's the brain that kind of tells us what our energy level is. And so when we have a gross inflammation, the cytokines and interferons are upregulated because we have a leaky gut, and you've covered so well. You did such a great job in teaching that.
Thank you.
When you do that element of health, you change how the overall inflammatory burden is present. It changes how the immune cells in the brain, the microglia, actually act. And if you change how the microglia act, then you can often see fatigue improve. But guess what? Sometimes individuals get stuck into a fatigue pattern, and just cleaning up the diet isn't enough.
Mm-hmm.
And then the next symptom is brain fog.
Mm-hmm. I see that all the time. It's probably one of the biggest. Fatigue and brain fog are probably the 2 biggest, autoimmunity or not, but 2 biggest complaints I have in my clinic.
Exactly. And that brain fog is because the brain is lacking the energy it needs to carry through the tasks that it knows it can do. It's just taking extra effort. It's for every 3 steps forward, it's 2 steps back kind of a thing, right? And then fear. I see anxiety being so prevalent in autoimmune disease. And and how many individuals come back and say, wow, I really feel better. I'm more calm. I'm less anxious after we've started to deal with the fundamental problems of their autoimmune conditions. Is remarkable. And then
we can ask you real quick about that with the anxiety, but do you think that do you think that the anxiety is part of the cause of the autoimmunity, or do you feel that it's a symptom of the autoimmunity because there's a lot of fear out there, right? You get diagnosed with an autoimmune disease, you go to a conventional doctor, you're told it's only going to progress, you have to take these really harsh medications, it's the only way to do it, you cannot reverse this is a lifelong condition, and then suddenly, anxiety kicks in because you've been given this diagnosis. Versus if somebody's coming to see me or you, we're telling them, oh yes, we can often reverse or stop this, and we can get you better, we can get you off these medications, and so then therefore that fear and anxiety is lifted.
Yeah, well, it's always a chicken and an egg with the brain.
Of course, yes.
So absolutely, those experiences are very anxiety provoking. However, the inflammatory nature of autoimmune disease actually makes it harder for the neurons to regenerate their energy from firing. It starts to, the more of the brain's energy is going to dealing with the inflammation rather than feeding those neurons for repetitive firing. When we do brain mapping on individuals, we actually put a cap on their head, measure their brain waves, and we do a test called evoked potential. And those individuals that have slow evoked potentials have a hard time resetting their brain, or have a hard time having adequate speed in their brain. And it's interesting how often this elevated P3A and P3B evoked potential, which basically means a slowed attention system or a slowed working memory system, how often those go along with autoimmunity. When the brain is inflamed, it just doesn't work as fast. And when it doesn't work as fast, it gets overloaded more easily. So not just are people scared out of their wits about, oh my gosh, what's going to happen to me? Because when the people recognize that the highest risk factor for developing an autoimmune disease is having an autoimmune disease, that's a very fearful thing. And if you're not working with somebody who's dedicated to addressing the underlying causes of how that started in the first place, that'd be very fear-provoking. And then the last thing I put down was funk. You know, funk, just depression. I mean, literally depression. We know that, again, inflammation can mess up the serotonin cycle. Inflammation will cause tryptophan to not turn into 5-hydroxytryptophan, serotonin, melatonin, all these kind of happy, good chemicals, neurotransmitters, right? But instead, inflammation will cause that tryptophan to be sucked away into making a brain irritant called quinolate. And that quinolate is actually not just a brain irritant, but it's so you're getting this tryptophan, this remarkable amino acid, getting pulled away from what will help with your mood and going towards a chemical that can actually exacerbate depression, can exacerbate the problems. So, but in that case, I see autoimmune disease being very much the cause of depression. But why is it that we have many individuals with autoimmune conditions, correct? And some have fatigue, some have fog, some have fear, some have funk. Not everybody has the same thing. That goes back to, how is our brain wired in the first place? What are our susceptibilities? What is the weak link in our chain? And when that inflammation occurs, wow, you're going to irritate the weak link in the chain of the brain. And so that's why, we see one condition, one named condition, autoimmune thyroiditis. We see so many different symptoms coming out of that, right? Because the person's underlying biochemistry is unique. If you just segregate out the symptoms that come from the brain, we always have to honor the person in the process.
So what is brain mapping? You sort of alluded to it, but what is that?
Okay. Brain mapping is any way that we can understand how the brain is functioning, and we can put it on paper. There's many different ways you can brain map. There's some very expensive ways using SPECT imaging or functional MRI or PET scanning that may or may not use radioactive elements to do that. And then there's a pretty easily accessible tool called EEG brain mapping. This is where we put a cap on your head, and there are 19 little electrodes in that cap. We squirt some electroconductive gel in those little connectors to your skin, and we measure your brain waves. Take your brain waves and we put them through an evidence-based or an FDA-registered database of average normal brains. And then we see, how does your brain differ from this average normal? Now,
okay, hold on. How do you figure out what average normal is?
That's what I was just going to say.
I mean, considering it's sort of like, a thyroid test compared to all the people out there, but most everybody's walking around hypothyroid and obese, and, we've become such a sick society. How do you get somebody who has a normal brain?
Yes. And so that goes a little deeper. And I'm going to digress for a second, because when we assess the brain, we look at 4 different things. One is your story. So that's all your symptoms, your problems, what you think is the issue, right? The second is your soup. That's all your biochemistry. The third is your skill. This is when we have you actually do brain stress tests, right? Where you're doing a repetitive task or a difficult task, a memory task, a processing speed task, and those are normed. There's a group of people that we know, the population general performance. So that's skill, and the last is spark. That's the electrical baseline of the brain. So you don't ever assess the brain with just one of those, because the brain is a very complex organ. So just thinking of like a mountain, you want to come at it from many different angles, right? You want to come from several different angles. And that would be, so again, story, soup, skill, and spark. And so the spark is the part I'm talking about with brain mapping.
Okay.
And so it's one angle. And you ask, well, what's normal? I was trying to interrupt you and say, yeah, there are no normal brains. Thank the Lord, there are no normal brains. But if you take the group of people, which is 100 individuals that make up the database for a particular age group, if you take any one of those persons and compare them against the database, they will still have things that look like they have more or less of a particular brainwave. Mm-hmm. So even the people used in making the database aren't going to be all, quote, average. We love uniqueness, and just because we see a uniqueness on a brain map doesn't mean that that person has a problem. That could be a particular genetic underpinning, that could be a particular gifting. And so, but it's amazing when you do a brain map on people and they get to see their brain, and now they sit back and they have this experience of going like, wow, I'm not to blame. This is my brain. It's not my soul. Let's talk about this, that your brain is your issue. Here in your frontal lobes, there's a huge asymmetry in the alpha brainwave, and that's highly correlated with individuals that have depression. And we know that individuals with this type of asymmetry tend to respond to a particular type of neurofeedback. Mm-hmm. And so at one time, this is what good data does for people. Both, it gives them a good direction, so they start to take action, and it can remove some of their guilt and their shame. And now they can move forward with more joy and saying that, all right, I now know the problem. It's not me, it's not my soul, it's my brain. Mm-hmm. That's actually a very helpful way to look at it.
And so where does somebody get this brain mapping done? Are there certain people who are trained in brain mapping? How does somebody find somebody that does that?
So I would say there are several different ways to get a brain mapping done. There's companies that do brain mapping. One of them that I like and work with is called Evoke Neuroscience. And you can actually go to www.evokeneuroscience.com, and they will help you find a practitioner. Likewise, there is a professional organization called ISNR, International Society for Neurofeedback Research, and that's isnr.net, I believe. And that's another good resource to find somebody that can help you with brain mapping.
But explain the difference between biofeedback and neurofeedback.
So biofeedback is making the unconscious conscious. So imagine holding a thermometer in your hand and willing it to get hotter. Mm-hmm. And do this. It's actually quite simple to do. You can train your skin to get warmer and train your skin to get cooler. And so that's making the unconscious conscious. That's biofeedback. And biofeedback can be done with temperature, with the amount of sweat on your skin, with the amount of muscle tension that goes on. It can be done with the respiratory rate, heart rate, all of those biological functions, biofeedback. Neurofeedback is biofeedback using brain waves. And so you are placing an electrode on someone's head and just watching what electricity do they make, what kind of brain waves do they produce. And as they make those particular brain waves, you help them become aware of that. And you set a goal. All right, this individual wants to have a higher state of focus. So we're going to have them increase the amount of beta in one part of their brain, which is a fast brain wave associated with concentration, and decrease theta in the frontal area of the brain. And now you're going to have, when the person manages to raise beta and lower theta, they get a reward. And the reward is as simple as looking at a screen on a computer and having a movie get bright and loud. And when the brain moves away from making the brain waves we want to reinforce, the movie gets dark and quiet. And so the brain wants to watch the movie. Mm-hmm. So it figures out this electrical combination lock to turn on so the movie will stay bright and loud. And it works because neurons that fire together wire together. So that's what neurofeedback is training the brain to wire in a way that's more efficient.
How would that be, I guess, sort of the implications of that in something like autoimmunity or chronic disease would be that if something like your disease is creating inflammation in the brain and maybe causing you to spike, in the area of depression or anxiety, that then you can train the brain to calm that down. And then in theory, that would be calming the rest of the body down and helping with the disease?
A couple of different angles here. So
Okay.
One is, let me give you a case example.
Okay.
The 40-something-year-old oncology pediatric nurse, delightful soul, came to me with fatigue, tiredness, brain fog, anxiety, and really had it was being quite beside herself. She'd seen several physicians, and she'd been recommended to go on thyroid hormone because her TSH was hovering around 9. Her anti-TPO antibodies were in the 200 range, and she didn't want to do that. She didn't want to go the thyroid route. So we had a discussion about her anxiety and her brain fog, and we started her on an excellent elimination diet using an anti-inflammatory medical food, fish oil, probiotics, and when she came back about a month later, about 50% of her symptoms were down. She knows her anxiety was less, was doing better. And so we said, well, good. Let's continue another month. We rechecked her labs. Her TPO antibodies had dropped down into the double digits now. Her TSH had come down to a 3.2. So her thyroid was healing very quickly, actually, on this restricted diet. Anxiety still wasn't what she wanted it to be. When I asked further, has this been a lifelong problem for you? She said, well, not really. Maybe since high school. And she didn't identify that it was a major issue for her. So we're seeing all these biochemical parameters better. We continued on the diet for, again, another month. She didn't notice any additional improvement in any of her other well-being. We had done other biochemical evaluations, fatty acids. We'd looked at her gut function, a lot of the other things that you and I, as functional medicine docs, that I would already have looked at, right?
Mm-hmm.
And so there weren't those avenues, but she was still stuck with anxiety to the level that she was not enjoying her work, and she was unable to function as highly as she wanted as a wife and a mother, and she thought this was all because of her thyroid. So we started neurofeedback with her. We found her brain map that had improved. Her brain map, that's an important point, her brain map actually improved on just the diet.
Oh, wow.
Her beta waves came down, so we could see objective markers of brain function improving with a standard elimination diet support structure, something we call our restoration experience. And so we started neurofeedback, and it was remarkable how her anxiety came down now to only about 10% of what it had been.
Mm-hmm.
And at an additional 10 sessions of neurofeedback, her report to me was, she said, listen, I now love my work. I feel a calling to serve these parents, to be there stand in the gap for them at this incredibly stressful time in their life. I've never felt my job as a calling. I've never had joy in the midst of everything, knowing that I am the right person to be here at this time. She said, and that's because I don't have anxiety.
Awesome.
I'm actually able to be more fully who I have always been. And I teared up.
Oh, I have goosebumps right now. So
yeah, but it's how do you get people that next level? Now, my hypothesis was that her autoimmune conditions actually started back when she was a teenager in college. And I think that the ongoing inflammation in the brain was such a stressor to her long term that she wired herself to get used to being anxious.
Mm-hmm.
Because anxiety, if you give somebody a lot of cortisol and a lot of norepinephrine, a lot of adrenaline, they're going to be more anxious, right? Well, those are our antidote hormones to inflammation.
Mm-hmm.
So you have chronic inflammation, high antidote hormones present, and you train your brain to be anxious over the long course of time.
So tell us, we've heard a lot about leaky gut, but we haven't heard as much about leaky brain. What exactly is that? And what are the causes of that?
Many of the same connectors that hold together epithelial cells in the gut are holding together what we call the blood-brain barrier. And these are connections from that are controlled from the inside of the brain to either allow nutrients into the brain or to allow places for toxins to get excreted from the brain. When the brain's been injured, especially in a head injury, a concussive whack, you get a bruise. And that bruise can breathe to the blood-brain barrier, not just the tissue underneath. And now you get more leakage of antibodies into there. So any type of immune upregulation is going to affect that area more. So, leaky brain is a component of most every head injury. And some of the same chemicals that cause leaky gut to occur also cause more of the leaky brain to occur. And I think this is part of the brain fog. This is why we see healing happening over the course of time. There's initial wonderful gains when you make dietary changes. And then cleaning up that mess to really get back to optimal function can take some time, depending upon the individual, correct?
And what would be, how could somebody know besides a head injury if they have leaky brain? Are there some signs or symptoms when you mentioned brain fog? But for the listeners out there that are kind of curious, do I have leaky brain?
Yeah, there's not one single test, that we can measure a blood sample that's consistent. There are some that are in the workings. I'm visiting a new metabolomics laboratory actually on Monday, talking about another way of looking at blood-brain barrier integrity. So there's not a single blood test one can do, but instead, if you have a leaky gut, leaky brain is very much a likelihood. Or if you've had a head injury, really at any time in your life, leaky brain may be an issue. And leaky brain is so hard to define because what if it is just a focal abnormality, one very small spot of the brain? We can see brain irritation on the EEG. It depends upon where the injury happens. With regard to a head injury, what kind of symptoms you're going to have. For instance, one of my patients right now actually has a head injury and also has dermatomyositis. Now, what a challenging case she presents because she has these dual conditions going on.
Will you just tell people what that is? Because they may not know. Even though it's an autoimmune condition, they may not have ever heard of it.
Yeah, if it's a big, long, scary sounding name, it's probably an autoimmune condition, right? Dermatomyositis is, to break it down, there's an itis, an inflammation. So dermato is skin, myo is muscle, inflammation. And this can be characterized by elevations of muscle proteins in the blood, by changes to the skin, a lot of pain, a lot of aching, very debilitating condition. And of course, she has leaky gut as well as co-infections on stool analysis that probably cause something called molecular mimicry, where those particular bacteria trigger an immune response against that person's own tissue. So she had all of those going on as well as antibodies against aflatoxin. So aflatoxin, this was done on a Cyrex panel 11, which I've really been impressed with clinically.
I haven't used that one yet.
In difficult cases, it's a very helpful test because it looks at the toxins, molds, and how do these nasty molecules actually attach themselves to your functioning molecules and thereby turn what looked normal to their immune system to looking like an outsider, an invader, and triggering an autoimmune response. So she had very high levels of aflatoxin, which is a mold that's found on peanuts and beans. So we changed her diet.
It's also in houses. Yeah. So anyway, we can talk after this if you need some guidance on that.
That's great. That would be great.
Yeah.
We'll talk more. And and so if you remove those triggers, her, then she has a potential. Did
she get improvement from removing the beans and the peanuts?
Yes, she did.
She did.
We had already removed grains, removing legumes, unless that she washed them. She washed, soaked, and change the water out several times because aflatoxin doesn't get broken down by cooking. That's one of the difficult parts of aflatoxin. And because she had been eating a lot of beans in her diet.
She had, okay.
And she also noted that when she made her own hummus, she was fine. When she would get some store-bought hummus that had a good ingredient list, she felt awful. Because she had the habit, when she made her own hummus, she would make chickpeas, soak them, wash them, rinse them, and then blend them, which would probably get rid of some of those aflatoxins. So to continue the process of digging, to always be curious about what is there. I want to encourage anybody listening to this, please don't give up. Do not stop asking why. Keep thinking of what. The body is not meant to attack itself. It is not designed to do that. So what is off? It takes such courage to stick with that question. It takes such tenacity. And if you can't stick with it, consider that your brain may be getting in the way of your healing. So
the other is that, you know, people don't often have access to physicians like ourselves, which is one of the main parts of this summit, is to offer people guidance and help. And that when they're seeing a practitioner who isn't asking the whys, you know, it's really, it can be frustrating and overwhelming and disheartening, right? I mean, when you're like, I read this book and I heard this talk and I wanted to talk to you about this, and the other doctor's poo-pooing it and saying there's nothing to it, you know, they just don't know where to go. They don't know where to turn. And so it's also just kind of a, you know, bummer that you know, that they're wanting that why, but they're not getting it from their practitioner.
Yeah.
So
and my patients teach me so much. I am so honored that my patients spend so much time researching their own health. And, you know, I think of all of them as like my research assistants. So I have this army of research assistants finding what's latest and what's newest, and they're always trying to scoop me.
Yeah. Yeah, me too. I always say, I'm like, I don't have an ego about it. Like, I have so much time that I'm spending doing all this other stuff. If you have like something really obscure that I haven't seen yet and you want to get on blogs and forums and somebody's tried something, as long as it's not anything that's unsafe, let's try it, you know? I mean, I love that, you know, learning every day.
That's so great, because you just said, you said as long as it's safe, right?
Right.
It's that we're always running an experiment of one.
Yes.
You know, every one of us is unique. Let's run that experiment of one, and results are the only thing that matter.
Right.
And I think if we keep that in mind, that results are what matter. And yeah, that was one thing. I made this sound like Jeff Bland hit me out of the blue with functional medicine. I was very frustrated with becoming kind of a legal drug pusher. You know, I was realizing my job was not, as an allopathic doc, was not to create health, but rather to treat disease. And the two of those are not necessarily synonymous, right? Those are two different tracks. They're both important. But my passion is in creating health. So with histamine intolerance,
yes,
this is where histamine, we think about it a lot when we take things that are antihistamines, like Benadryl or Zyrtec, Claritin, to treat allergies. Or when you get a hive, you know, that would be a swelling on your skin or a welt. That's being caused by histamine being released in the skin. Now, think of that welt. That means that histamine has caused the blood vessels to become acutely leaky. It has opened them up so that fluid can gush into that space and maybe dilute the poison that's there. Histamine is a defense molecule for it. It's very important. And we also have, but histamine works the same way everywhere in the body. So if you have very high histamine levels in the bowel, it will cause those epithelial cells, the lining cells in the gut, to spread apart and will cause an acute leaky gut for individuals. There are two major enzymes that break down histamine. One is histamine methyltransferase, and that has to do with the whole methylation process. And then there's also diamino oxidase, which is an enzyme that breaks down histamine in the bowel. And this enzyme also floats around the bloodstream, breaking down histamine. So when individuals have an injury pattern, they will, so say they've eaten dairy. When you're sensitive to dairy, boy, you can have cause a lot of injury to the inside of your gut, and now some of those little villi, where the absorptive surface of the bowel, you have a breakdown of the enzyme, or you no longer produce this diamino oxidase. So a leaky gut can't make the enzyme to break down histamine. Well, that becomes a double whammy, doesn't it?
Mm-hmm.
So you have a leaky gut. Now you can't make the enzyme that breaks down histamine, which is another factor for causing an acute leaky gut. And so when you eat foods that are really high in histamine, you can't break them down, and that we call this histamine intolerance syndrome. And by taking a supplement that contains diamino oxidase, you're able to actually break down the histamine in the gut, stop that ongoing repetitive histamine-induced leaky gut, and actually improve the process of healing.
Mm-hmm.
You know what's cool, Amy, is that DAO levels in the bloodstream are actually a really good marker for how much of this villus injury you have, how bad the leaky gut is. So I find that measurement to be very helpful. I get mine done through Dunwoody Labs, and they have an excellent marker for measuring this diamino oxidase as well as zonulin, which I'm sure you've talked about quite a bit already.
Yes, and we have Dr. Fasano on the summit as well. I mean, I use them as well after you introducing me to them, and I love that test because it gives you a zonulin level, it gives you the DAL level, and the histamine level. And, those of us, I've had autoimmunity. I mean, everybody thinks, oh my gosh, you're so perfect. You live this whole lifestyle, but I got exposed to molds, and then, I mean, who knows what happens, over time, that we get other exposures and can slip backwards. So I found that, I actually was having a leaky gut. My DAL was low. I was eating, of course, all the high histamine foods of, bacon. I'm eating a paleo diet with bacon and avocado and, and then so I removed those foods, worked on, healing my gut again, and then took the supplement. And then, I was a nut. I was like, I'm not putting anything in my mouth unless I have that supplement. And it's expensive because apparently it comes from cows in Europe.
Pigs.
Oh, pigs. I thought it was cows. And, was like not eating a bite without one of those supplements. And then very quickly, I mean, within a matter of weeks, was able to, not need to use it, retested, zonulin down, no leaky gut, DAL, everything great. And I mean, if I eat a super high histamine food, meal, I might take some just prophylactically here and there. But right. I mean, and I love the, seeing the whole big picture, seeing it fit together. And then I love fixing it and seeing it clinically get fixed and then, repeating tests. Because not all my patients want to repeat tests because I tell them, it's expensive. You feel better. If you want to spend the money on it, I always love the data, but I understand if you don't want to spend the money on it. But I always spend the money on myself. It's where all my resources go to testing. So I'm always doing and then retesting. So I loved being able to see that like before and after because I don't ever get that satisfaction. Or not that I don't, but I don't frequently get that satisfaction. I get the satisfaction of the patient getting well, but not always the lab to prove it if it's one of these out-of-pocket, tests that you have to do.
Mm-hmm. Mm-hmm. And you know what I love about DAO is that it follows the important rule that a great therapy is one that the more you use it, the less you need it. Mm-hmm. That's when we know we're inducing healing. And I love to focus on therapies that the more we do them, the less we will need them in the future. Right. And that's really when we're creating health. It's one of the things I love about neurofeedback. Instead of putting on a person on a medication long term, what ends up happening is you can help train the brain to be healthier long term, to actually change, to have a different brain to carry forward.
The last question before we part is, many people can't see a functional medicine doctor. So we're trying to give them 3 to 5 tips that they can do today, right now, to either prevent or reverse autoimmune disease. Mm-hmm. You have some suggestions for our listeners out there?
I do. I have one big one.
Okay.
Right? One big one. And it's paced breathing. So there's a very simple technique that does amazing things to your brain, and it does amazing things to your gut, which is paced breathing. This is a simple technique of a slow inhalation of 5 seconds in, 5 seconds out, 5 seconds in, 5 seconds out, and focusing on gratitude and thankfulness during the process. And what you're doing on a biological level here with this nice, slow kind of yogic breathing is you're massaging your vagal nerve. This is a nerve that wraps all the way down your esophagus and your stomach and your guts, and you're massaging that nerve. And what happens is the nerve starts to signal to the brain to say, turn off your stress signal. And as a result, when the brain turns off its stress signal, lowering cortisol and improving your immune function becomes more targeted. It becomes better behaved, shall we say. And then, not only that, when you do paced breathing, you'll start to release more of cholecystokinin. This is something pretty new. And cholecystokinin not just releases more digestive enzymes and releases more bile, so you digest your food better, and you improve all of the factors that lead towards leaky gut. Cholecystokinin also directly helps regulate the stress response in the brain. So here we have this wonderful, simple technique of paced breathing in gratitude, improving that mealtime gratitude has massive effects. This is not a little thing. So sit down and pace breathe. Nice, slow, in, out, 5 seconds. Experience incredible gratitude. Have thankfulness for the food that's in front of you.
How long do you do that for? How long do you do that for?
30 seconds.
Oh, okay.
I would really say that no less than 30 seconds.
Okay.
And quite an experience, actually, to sit down at a meal and do that for 10 minutes before you eat. It is an amazing experience. And how you taste food and how that becomes electric on your palate, and your bowels are so ready to do their job of digestion and assimilation on a level that you just don't get in our, whisked through our workday kind of a, think that just because we put food in our mouth, we're nourishing our bodies.
Right.
That's really not the case. But if I only had one tool the rest of my life to give all of my patients, it would be paced breathing. And I've said that for 10 years because I've never seen something so simple, safe, effective, and cheap produce such massive results in people's lives if consistently used.